Everybody sign a roll for me. Another thing I'm gonna pass out is a confidentiality and non-disclosure agreement for Children of Alabama. So it's a HIPAA privacy statement. Read through your bullet points here and then print your name and sign it right underneath that. That's all you have to do. And then we'll collect all those at the end as well. So take one and pass, please. Basically saying you won't share any patient information, patient data, anything that they do with their facility. Should be just one page, print and sign.
Is there a thing where you go? I know the program is a little broken, it's like, you go to the museum or something? No? You know what I'm talking about?
Say that again?
Let me ask you what it is.
That would be so fun. How do I go there?
I think like the nurses, like in this semester, they go to like a museum or something.
Oh, yeah, we did that during, but it's not there no more, so.
What kind of museum was it?
It was the, human body exhibit in Atlanta.
Yeah.
I can't remember what it's called, but the bodies exhibit, yeah. And so they had like all the vasculature pinned out, so you could see all the vasculature. They had a bunch of cadavers. They had all the skin of. Yeah, it's kind of traveling around the country, all the different organs and stuff, and it shows you the entire human body anatomy and all that. It's super cool. Yeah, we got contact hours or program hours for that. We did a lot of cool stuff back in the day, but we don't do it as much anymore. I got flowers for going to the state autopsy department too. So.
I don't think I went over there.
It was different. I didn't like the little kid autopsy. I stepped out for that one, but everything else.
Is that Montgomery?
We're going down the interstate right there, and you have kind of AUM exit right there on your
I mean, I
right.
don't know.
Everything's about
The worst one was this little old man burned up in his car. And so when they like dumped it out of the body bag, it was basically like ash and bones. But
That would make me so sad. I don't
when they like cracked open his skull, it looked like scrambled eggs.
Nice.
Yeah, it was different.
No, it's in the spring, you be eating, it does not bother you.
Oh. Okay. So,
Do we check this down here?
sure, you can check student if you want to. That'll help me out. Or circle it somewhere in there. The formatting's a touch off. I think it kind of messed up when I changed it to a PDF. Please make sure I have that by the end of the night, so before you leave, just stack it up somewhere. The roll should be going around, and everybody should have a Children of Alabama confidentiality agreement. All right, short, quick, to the point tonight. Professionalism. A lot of this should be self-explanatory when you're looking through it, reviewing it. It should kind of make some sense to you, but it's one of those things that we have to cover. One of those more intangible things, something that's not concrete. More of kind of a broad concept. But again, trying to get you prepared to be that well-polished nurse before you go out and represent somebody. So professionalism. When we're testing on professionalism, leadership, management, that kind of stuff, it's more about roles. What is the role of the nurse? What's the role of the LPN, the multi-care technician, or the unlicensed assistive personnel? There's a lot of names out there for that kind of stuff. But what are those roles? What are they able to do and not do? And so that's kind of what we're gonna test you on, is your ability to know and be able to delegate specific tasks, certain treatment plans, that kind of stuff to your other personnel that is around you, okay? So again, unlicensed assistant personnel or multi-care technician, patient care techs, nurses aides, whatever you wanna call them, they all kind of get roped into a certain category. These are people that are not licensed, don't have any type of certification. So really anybody off the street can come in and be a technician. And that's not to degrade them or talk down upon them. These are very essential to the overall healthcare team. but they don't have any type of licensure. They only have very specific type of things that they can do, but they're under that direct supervision of that nurse. So things like bed baths, vital signs, assisting with feeding, assisting with ADLs, toileting, that kind of stuff. That's what this UAP or MCT is going to be. Again, they're very essential to that healthcare team, so don't feel like this is somebody that's whatever or nothing. Okay? I really enjoyed my time as a tech, and I learned a lot of valuable information from it, so very essential. But they work under the direct supervision of the nurse. That's important to know. Kind of our next grade up from a MCT or UAP is going to be your licensed practical nurse, or LPN. So these are certified. They do have licensure from there. Main goal is to promote and maintain health, prevent illness and disease. They're again going to work under the direction of a registered nurse or a physician or a nurse practitioner, someone that's a little bit higher than them. When you're thinking about an LPN, what type of things or tasks or treatment plans can they do? Any thoughts? Megan, what do you do every day?
Too much. I
You're chewing.
medicine,
Okay.
start leaves, maintain non-polyps.
Can you do an initial assessment? No? Stephanie? Anybody that's an LPN, can you do an initial assessment? What about blood products? Can you do blood products? Okay. Can you do IV push meds? Depends on what?
Facilities.
Facility, right? Alright, so it's gonna be state and facility specific on the exact thing that LPNs can do. General consensus though, they cannot do an initial assessment or kind of a diagnosis or treatment plan for their patients. They're really there to carry out that treatment plan and to monitor for ongoing monitoring of that patient. So they can't do the initial assessment, but they can continue to monitor from there. Certain IV push medications, it depends. Certain narcotics they're not allowed to do, certain pain meds, that kind of stuff they're not allowed to do. Some states don't allow them to do IV push at all. They're only specific for PO, sub-Q, some topical type stuff from there. Again, blood products, they usually don't do those as well either. For your exam purposes, I would say no blood products. I would say no IV push meds. But as you're going out and you're working in the real world, and you're uncertain or unsure what the LPN can do, or if there's an LPN under your scope and you're kind of managing them, ask them what they can do. And if you're still unsure, you can ask your charge nurse. You can look at your state and federal policies, your facility policies, things like that, and get you a good idea. Don't just start delegating stuff and then figure out on the back end that they can't do it, okay? All right, next step up is gonna be your registered nurse. A little bit different, care and counseling of the person, promoting that health, maintaining that health, prevention of illness. We're carrying out a specific set of nursing care orders under the supervision of a physician or a nurse practitioner. That's really kind of the only people that are above us at this point. So some nurse practitioner or physician. And we cannot really vary from that path without further guidance, without more orders. So I have a set of orders that I can work in within my scope of practice that I'm allowed to direct my treatment or my care for my patient. Once I need something more outside of that defined scope, I've got to ask for more help. I've got to ask that physician from there. With this, the registered nurse is able to delegate to the LPN, delegate to the MCT to help them with the overall process of care for your patient. Remember, when you're delegating, You are still responsible for everything else that's involved, even though you delegated that off. So if you delegated off those vital signs to that MCT, you're still responsible for those vital signs. If there's something out of whack or abnormal, you can't say, oh, well, that's the tech's responsibility. It's still your responsibility to make sure that tech is understandable, knowing how to check those vitals, that actually knows how to check a blood pressure correctly. And if there's anything abnormal, that you ask that tech, hey, what was that last blood pressure? Oh, that's abnormal. I need to go in and I need to give a medication to rise or lower it, that kind of stuff. You're still responsible even though you delegate it off to other people, okay? With the registered nurse, we're not allowed to diagnose or treat our patient. That's gonna be outside of our scope of practice. We have kind of our nursing diagnosis, but I'm not able to formally diagnose, treat, come up with those care plans. That's a physician or an advanced practice nurse is type role. There's several options for an advanced practice nurse. So we have something like a CRNP or a certified registered nurse practitioner. We have midwives, we have CRNAs, and we also have nurse educators. Okay? With this, the registered nurse has gone through more advanced training, more extensive type training in a particular field or practice to allow them to practice independently of the physician. There's still oversight that's involved. The physician still checks in periodically here and there to make sure they're compliant. And then the nurse practitioner will also communicate with the physician as well if there's any questions about orders, things that may seem abnormal to them, that kind of stuff. With your CRNP, there are several different specialties out there to choose from. So you have like a family nurse practitioner, that's what I am. You also have acute care nurse practitioners that work more in the hospital setting, and they can do more critical care side of things. Usually the family nurse practitioners are gonna work more on the clinic side of things as well. Some hospital facilities will allow a family nurse practitioner to work within the hospital and in certain specialty areas. Dr. McCarty is a family nurse practitioner as well, but she works in CVICU and covers for CT surgery and cardiology. So she's in that type of role, but she has previous experience in the CVICU setting. She's still not able to do certain procedures like putting in central lines, chest tubes, VASCAS, that kind of stuff, because she's not trained with her family medicine background. Okay? Nurse midwives, their big role has to do with women's health, so health promotion on that end. So the OB side of things, they're able to deliver as well, and they kind of work under their own scope of practice. So that anything women's health related, that's what your midwife is going to be with. With your CRNAs, they're more focused on anesthesia medicine. They kind of work directly with the anesthesiologist to provide sedative type care, pain management. So sometimes they'll do nerve blocks, they'll do epidurals, that kind of stuff. So CRNA kind of goes that route, works with the anesthesiologist independently with that. Don't get these confused. There's a new program that's coming out, anesthesiology assistants. It's been a hot topic here recently. CRNAs hate each other with the anesthesiologist assistants. They're fighting with each other right now, but don't get them confused with that. CRNA has a lot more independence than a AA or anesthesiology assistant. The AA has to work directly with the anesthesiologist at all times. Okay? And then, of course, you have nurse educators, such as myself or Dr. Fuller, any of us really. You have to get a master's for that as well. So these are master's level degrees. And then you can get a terminal degree or a doctoral degree. After that, there's really not a whole lot further you can go unless you want to go and change careers. Okay? That is not my plan. After I get my doctorate, I am done with school forever. So, questions about APRNs? Okay. So like I said, how we're gonna test you on professionalism, leadership, management, these types of situations is more of the roles and responsibilities of certain, providers or nurses, LPNs, MCTs, that kind of stuff. And so we'll do a case study to kind of get you thinking about how would I delegate certain situations, what is the role, the responsibility of certain people. So really think delegation, roles, responsibilities when you think about professionalism, leadership, management, that kind of stuff. So all right, let's talk about case study 1. This is our initial presentation. So we have Mr. Ricky Bobby. He's a 65-year-old male. He's got a history of hypertension, AFib, non-compliant with his anticoags. His chief complaint is sudden right-sided weakness and slurred speech. Last known well time is 90 minutes ago. So right off the bat, is there anything that's concerning for us? Right-sided weakness, slurred speech. So what are we already thinking? Stroke. Why are we thinking stroke? Besides the symptoms, we have AFib, non-compliant with anticoags. So he's probably throwing some type of clot, right? That makes sense. We don't have any other information, but this is what we got so far. All right, let's go a little bit further. BP 168/92, heart rate of 96 and irregular, respiratory rate of 18, O2 sat 95 on room air, glucose 110, level of consciousness is awake following commands, speech, expressive aphasia, motor skills, right arm and leg weakness. So really the only two things we're concerned about are these two, right? He's irregular, but he's irregular all the time, so that doesn't really matter a whole lot at the moment, but these last two right here, okay?
Blood pressure.
Yeah, blood pressure is a lot, I guess. All right. Question 1, which action should the RN take first? Zach, what you got? Still reading?
I'd say B.
Anybody agree with Zach? See a lot of yeses. Anybody disagree with Zach?
Well, who do you agree to?
I want to see what y'all see before I say anything. Yeah, perform a focused neurological assessment. I like that answer. Zach, why'd you pick that?
Well, we don't really, his blood pressure is, it's high, but it's fine.
Okay.
And then we don't need to delegate anything because he's obviously got something going on. And then physical therapy is probably gonna take 2 hours to get there. So B's the only thing you can do right now that matters.
Okay, yeah. Do we really care about physical therapy at this moment?
No.
At some point, maybe so, yeah. A, antihypertensive, I could care less about his blood pressure at the moment.
Clearly already having a stroke.
He's already clearly having a stroke. Delegating vital signs to the UAP. Maybe I can do that in the future, but not at this moment. Is that my priority action right now? No. My priority action is perform this focused neuro assessment because I need to get a baseline or a goal to see if there's any slight changes. Because remember, a slight change in that LOC is going to tell me a lot about my neuro status. So that's why I want to do a focused neuro assessment. All right, so which task is most appropriate for the RN to delegate to the UAP at this time? Sam says B. Does everybody agree?
Yeah.
Okay. Can they assess or perform neuro checks?
No.
No. Okay, so remember, this is how we're getting into these roles and responsibilities. Can they assess the swallowing ability?
No.
All right, and then monitor for signs of increased intracranial pressure? Definitely not. Okay. So really the only thing they can do is assist with repositioning using proper body alignment. What if I threw LPN into the mix? What could my LPN do? Could they do any of this? I could definitely do B because the UAP can do B, right?
If it was a focus assessment, they could probably do A.
They could do A if the initial's been done.
Right.
They
So,
could do D too.
D, certain facilities, increased intracranial pressure, you can do monitoring or ongoing assessments. And so that's gonna be some of those key words that you're gonna look for. Ongoing assessment, monitoring. Has the initial assessment been complete? You're gonna see those type of words that are gonna be in these questions. And so that's what you're gonna kind of look for. But you're not diving further into it. If you don't have that information, then you don't have it. all right? Don't come up with the information. All right, you're not looking for zebras. Whatever is presented to you, that's what you have right now, okay? All right, so here's our new order set. Mr. Ricky Bobby is admitted to the stroke unit. Swallow screening has not been done yet. Here's our new orders. NPO until swallow evaluation, neurochecks Q2 hours, maintain the head of the bed at 30 degrees, and continuous cardiac monitoring. Do we agree with all this?
Yes.
Sounds about right? If I said vaginal exam on here, would I question that order?
Of course.
Probably so, right? Okay, so you might have some things. What would you question the doctor for? Or if I said, new orders for Levofed, do I need Levofed? It's a vasopressor, right? I don't need to raise his blood pressure. His pressure was 168 over something, all right? So I don't need that either. Okay. Again, which task can I delegate to the UAP? This time I'm gonna select all that applies. I hear A, everybody agree with A?
C.
Okay, I hear C
D.
and D. A, C, and D, everybody agree?
Yes.
Yeah, I like it. Maintain the head of the bed at 30 degrees. Am I doing any kind of intervention, any assessing, any treatment? I guess I am doing a kind of a little bit of a treatment because I'm maintaining the head of the bed, but I'm maintaining the head of the bed, nothing invasive. Assist with totality, I can do that as a UAP. And then report any changes in the level of consciousness. They may not know exactly the correct assessment, but they can say, hey, he's kind of sleepy now when he wasn't, or he's not answering questions when I talk to him. They can kind of notice those things. Anything an LPN could do?
Same thing that the other one could do. They
Yeah.
can't do E. Well, could they?
Yeah, if the
I would say
clinician,
no, I guess if it's
The
specific.
initial's been done.
if the initial's been done, okay? We can't do B at all because we haven't had a swallow screen done yet, right? We're still NPO until our swallow screen has been done. You haven't been told yet that your swallow screen has been done. All right, 4 hours later, the UAP reports the patient seems sleepier than before and isn't answering questions as quickly. So they did report to you that they've had some type of neuro change. They don't know what it is, but they just know that he's sleepier than normal, answering those questions appropriately. Okay? Now, what's the RN's priority action?
C.
Perform an immediate neuro assessment. Why? Sam?
It was a change.
Some type of change, right? Any subtle change in that LOC, I want to get another baseline of my neuro assessment. That should kind of be that red flag for you. I got to get in, assess real quick, and go from there. I don't want to document my findings because there's something abnormal. Then you're just a bad nurse. Okay? Vital signs, don't really care about them at the moment. Maybe I can delegate that to them eventually. This is new, ongoing initial assessment because of a change. So I can't delegate that neuro assessment to that LPN just yet. Okay. After my reassessment, this is what I see. Drowsy but arousable to verbal stimuli. I've got a GCS of 12, decrease from baseline. Our pupils, left 3 brisk, right is 4 sluggish. Increased right sided weakness. Our BP is now 176 over 96. PO2 is 94% on room day. Anything stand out?
Pupils.
Pupils, okay.
Blood pressure.
Increase right side weakness.
Okay.
Change in blood pressure, change in oxygen.
So if I was asking you to highlight specific information that would cause concern or be a red flag or something that you need to investigate more, you would highlight, say, right 4 millimeter sluggish, right side of weakness. You could talk about blood pressure. You could see some questions like that as well, highlighting specific results, that kind of stuff. Again, I'm trying to get you more into the NCLEX mindset, more just past the basic multiple choice questions, regurgitating the facts. We got to get you to apply this information now. You'll have a lot of information in your head right now. We got to get you to apply it. Okay. So the nurse called rapid response. They ordered a CT scan. Here's our results from that. So our CT scan shows no hemorrhage noted. So that's important, right? Okay. Our assessment, worsening cerebral edema. On our CT scan, new orders. Mannitol, IV bolus. Does that make sense?
Yeah.
That's gonna decrease our intracranial pressure, right? Okay. Maintain head of the bed at 30 degrees. Do we like that? Okay. Strict INO. Neurochecks Q1, and then put them on an ACE cannula or something for our SpO2 of greater than 95. Do we like all those orders?
Would you not do the neurochecks soon?
We could do sooner, but Neurochecks Q1's fine for now. But nothing out of ordinary that I would question, right?
Right.
Okay. So which intervention should the RN implement first? Of all those new orders, okay? IV mannitol. Everybody agree with that?
Yeah.
Everybody like that? Why? Why, Chuck?
His pressure down, ICP down.
Get his ICP down, okay, good. Inserting a Foley catheter, is that my main priority? Not yet, I really don't have an order for it either, but eventually I could put a Foley catheter in, right, to get that strict INO, but that's not my priority intervention at the moment. Reposition the patient flat for comfort, that doesn't make sense at all, right? Because if I lay my patient flat, what's my ICP gonna do? Go up, so I could knock that out altogether. Delegate intake and output monitoring to UAP, maybe at some point, but in the initial phase, I probably need to do that myself. That's not my priority. My priority is to get that IV mannitol into my patient as quick as possible. Which task may the RN safely delegate after the mannitol administration? Select all that apply. So I didn't say UAP or LPN, I just said delegate.
D.
I hear A, C, and D. Everybody agree? Yeah, sounds good to me. Anything an LPN can do?
B.
Yeah, they can do B after the initial assessment, right? Plus all the other stuff. Evaluate, that's another key word. Can my LPN evaluate or assess or initial assessment? They cannot. So the big things with these questions are those key words, things you're gonna think about. 2 hours after intervention, which finding indicates the most effective response to treatment?
C.
I hear C. Why not B?
Cause you treat.
Why not B, Josh?
I don't know.
You don't know? Anybody else?
Cause you're treating.
really
them.
concerned about
that in the first place.
It's 75 is,
75 an hour, that's okay, right?
I mean, I feel like this is a trick question because the blood pressure has improved, the urine output, we didn't know nothing about that. The SpO2 has improved.
But neuro-wise, what's the most important thing?
the biggest is.
I would say C.
Yeah, GCS, right? Because of level of consciousness. Yeah, you're right. C's right. Good. And then follow up. Over the next 24 hours, Mr. Ricky Bobby's neurostatus stabilizes. No further decline in the level of his consciousness is noted. He is transferred to a step-down stroke unit where he begins early rehab services, including physical therapy, occupational therapy, and speech therapy. Okay? So we saved you guys. Good job. Any questions about what kind of questions get your mind thinking about those kind of stuff? So like I said, these tests are gonna be a little more in-depth, kind of bringing out a little bit more of what you know. Okay, job interviews. I know y'all have been through a lot of job interviews in the past, I'm sure some of y'all have. Natalie, have you ever done a job interview? I'm not trying to call you out, I was assuming you would be the only one.
Probably not.
Probably not, okay.
I don't know if you count it. I mean,
Anybody
I've
else,
worked, but-
anybody else had gone through a lot of job interviews? You've done work and stuff before?
I mean, I worked at a boutique for 3 years and I worked at Auburn for a year, so
There you go.
sure, but I didn't have to, I had to make an A in the class, that's all I had to do.
So job interviews can be very stressful for some people, others, they don't really care. Myself, it is what it is. If I walk in there and don't get the job, I don't get the job. I've gotten every job that I've interviewed for, so I have no reason to be stressed. But for others, this is a big anxiety-driven moment. And so when you go out and you do your first nursing job interview, that's gonna be even more stressful, because your whole life is pending on this job interview. And I was pretty stressed about my interview as well. But these RN interviews are gonna be a lot different. Some of y'all that are LPNs now may have experienced some of this previously. But the style of question that they use is gonna be a touch different. They're more situational based type of questions that you'll see. And so let's talk about that. The STAR method of interviews. So when you're answering these style of questions, we're gonna use the STAR method, and this will be a good habit for you to get into. So the S stands for situational. And so when I'm asking these questions to you in just a little bit, we're gonna explain the situation that you are in. The interview is looking for specific information, a very clear, concise, detailed account of what happened. You don't have to exaggerate the story. You don't have to add all this extra detail, but you don't want to be vague. You don't want to be confused. You want to have a clear and concise representation of your situation. We're trying to minimize that patient risk. We're trying to look for, do you know your specific role, your place in whatever situation that you're in? You're minimizing harm, and that you're not practicing outside of that scope, okay? Your next one's gonna be task. So based on your situation, whatever task, responsibility that you got handed to, and kind of your steps to accomplish it. So here we are recognizing and determining that role. And you have a lot more experience than you think you do. Just because you haven't had necessarily a job in healthcare, how many clinical hours have y'all done? Way too many, right? So you can draw on those previous experiences from day one to the end. You've had a lot of different patient encounters, a lot of experiences within your clinical experience. So draw on that. So you can use that experience to answer these questions. But always remember that patient safety, patient quality side. That's what we're looking for as interviewers. I want you to be able to be a safe and competent nurse and not cost me a lot of money from lawsuits and different things causing patient harm. I want you to be able to take care of a patient like you're supposed to. And so your tasks and actions are going to be very similar, very close to the same idea, but your action is going to be those steps that you personally took to accomplish that goal, to accomplish that task. Be confident in what you did, that you knew your role, you knew your responsibility, but you're not trying to boast, like I knew what I was supposed to be doing. All right, be modest, but be confident at the same time. At this point, you can kind of talk about your skill set, what you know, what you don't know, what you're really confident in. I was excited that I was able to catch a stroke. I was able to catch a heart attack, something like that. And then at the end, you have your results. So any kind of positive outcome, anything that was generated from this situation or this scenario, they want you to be able to realize that I gained something from this. I learned an experience, my takeaway from this. Again, patient safety, quality, build upon your characteristics that you kind of learned, your strengths, your weaknesses, the outcomes of this. We're trying to get you to think outside the box a little bit. Not specific tasks, more of the outcomes, the overall general takeaway from this situation. Throughout this whole process, we want you to be confident, be able to articulate well. Don't be confused or disorganized, going back and forth between different things, situations, tripping yourself up. And don't say you didn't take anything away from this account. You always took something away from it, even if you have to make it up. You took something away from this. Okay? I want you to be confident in yourself when you have these job interview questions. When you show up for a job interview, these are going to be the type of questions that you'll see. So for an example, tell me about a time you identified a patient safety risk before harm occurred. He might get you to talk a little bit, and then he may ask, what data made you concerned? How did you escalate care? Or tell me about a time you had to make a decision with incomplete information. What guided your judgment? Tell me about a conflict with a coworker. How did you resolve it? We're all gonna have conflicts, so don't say I never had a conflict before. I'm not looking for a rehearsed answer. I'm looking for honest, open opinions, things that you've learned throughout your life, throughout your clinical experiences. We know that you're not gonna be a perfect person, so don't act like that. Be honest and open, but also reflect on your skills, your mindset, your ability to accomplish this task or this role, or to be able to act in this job role or situation. Tell me about a time you made a mistake. How did you handle it, and what changed afterward? We've all made mistakes at some point or another. And this not necessarily may be in a clinical scenario. This may be previous experience, job experiences, maybe throughout your school, you made a mistake, had to come up with a solution. How did you handle it? What type of reflection did you have afterward? Things like that. So those are the types of scenario-based questions that you're going to see really when you're nursing role, nursing job. So these are a little bit different than some of your standard job questions as well. And there might be some just general, hey, tell me about yourself, what are your hobbies, that kind of stuff. If it takes you a moment to come up with these answers, that's completely okay. Don't jump right into these questions and try to answer them just with whatever comes first into your mind. Take a step back, pause, reflect on the question, and then give yourself a confident answer. Okay? That's completely okay. And then at the end, a lot of times they're gonna ask, do you have any questions for me? Always have questions for the person. No matter if you don't really care about anything at all about what their facility is or anything like that, you're just trying to get a job and get some money, okay? Come up with something. Always have an interest in their facility and what they're doing, okay? Let me give you two good examples of a good answer here. Everybody hear that?
What was your least favorite patient? What was the situation? Any experienced nurse has had to deal with a patient that was unruly, untruthful, or just downright unpleasant. For this question, be sure to provide a specific time where you had to handle a patient like this, how you handled the situation, and what the final outcome was. The interviewer is looking for you to stay calm, cool, and collected despite wanting to fight back. I had an elderly patient who was struggling to maintain their independence, but suffering from dementia while recovering from a broken hip. They were resistant at times when they needed to take medicine, so I learned how to talk to them and involve their family members in order to encourage them to do the things they needed to for care. Tell me about it.
Did he attack the patient at all? No. He's still confident in his answer, but he didn't avoid the question. He did talk about the question. He answered the question. We are all going to have difficult patients, but he had a well-rounded, confident answer, but he also showed his skill set, his character about himself, and really promoted himself as a well-rounded nurse, okay? Let's do one more question here.
Check this out. I'm gonna show you how I afforded this card. Okay, you ready? All right,
Tell me about a time you had to communicate bad news to a patient. How did you effectively communicate that news, and what was the outcome? As a nurse, the need to communicate effectively to a patient is vital. This is no more evident than when delivering bad news. The interviewer will be looking to see how you handle yourself in a particular instance by showing empathy and composure where most individuals wouldn't be able to. Think of a time when you had to do this and talk about an instance that had a great outcome. As a pediatric nurse early in my career, my physician received lab results from a young patient found to have a brain tumor. When the patient and the family were called in for their consult, the physician and I were both in the room when the news was delivered. In that situation, it is hard not to break down with the family in tears, but I knew that they were looking at me to be the person with strength and have the answers to their questions. The physician and I were able to walk them through their next steps and options moving forward with their child's diagnosis, and they truly appreciate that.
Again, that gives you a good idea of what types of questions, what type of answers, responses, that we're kind of looking for, that what interviewers are looking for. His did sound pretty rehearsed. I'm sure he rehearsed it a lot before he did the video. But be raw, be honest. Don't put yourself in a wrong position or position that makes you look bad. But be honest and open with your interviewer. They'll appreciate it a lot. So some helpful tips. Research that facility, that position. So Jess, she wants to do OB and nothing else. So she's gonna research so much about St. Francis, right? St. Francis OB, she probably knows a lot about it already though, because she works there. But she's gonna research so much about that OB that she basically knows more about it than that interviewer. Maybe they recently had some type of award or certification that they just received. So you would ask that interviewer, hey, I saw recently that y'all received this OB reward. Tell me about that. How can I be a part of that? I'm excited to hear that, and I would be love and then be excited to be a part of a team that promotes excellence in OB. Something along those lines. It shows your interest in that facility and in that position. No matter if you care about that or not, you're still gonna ask those specific questions. Eventually you can start talking about salary and that kind of stuff, but that can be a touchy subject. So you don't want to lead with that first. You want to kind of talk about the facility, ask about potential training. What do you do for new grads? Is there an orientation process? Is there onboard training? What does that process look like? Is it a 6-month process, a year process? Do I check in frequently with a preceptor? That kind of stuff. That shows your interest and your ability and willing to learn and to adapt to that type of position. Arrive early. Don't show up right at 8 o'clock if your interview's right at 8. On time is late. For this one, be early. So be there at 7:30, 7:45, be right in there. You don't want to be there an hour and a half, 2 hours early, because then that puts them at an inconvenience. But you want to be there early, be ready, be prepared. It also kind of gets you in that mindset. It also kind of gets you back into research that facility and position. If you, for instance, when I interviewed for a job at Southern Union, if I didn't know anything about Southern Union at all, maybe I walked in here the week before or parked or know where to park exactly where I'm supposed to be. So the day of, I'm not rushing. I don't have all this anxiety because I know where I'm supposed to go, know where I'm supposed to sit, that kind of stuff. Hospitals are a very, very big facility, so there's no telling where you're gonna end up to do this job interview. So kind of research it before, ask questions. Hey, where is this located? To kind of get you in that mindset, kind of ease your anxiety a little bit as well. Confidence is key. I've been saying that a lot. Be confident in yourself. Dress for your position. Sometimes it's okay to be in scrubs. Most of the time it's not. I would kind of dress up for your job interview. But be modest with this as well. You're not trying to find a husband or a wife during this job interview, okay? So don't wear something like you would at the club. Be professional, all right? Whatever that may look like for you. Like I said, I'm not looking for perfection. I know you've made mistakes before. Everybody has them. I know that you have conflicts, different situations that have come up at some point in your life. Be open and honest with yourself. Don't sound like that textbook, like you've been rehearsed. That goes back into not looking for perfection, being open and honest, but being confident. Be prepared. So the night before, get you a good night's sleep. Eat something, eat some breakfast before you go. If you know you're gonna be anxious, arrive early. Check out that facility beforehand. Look at the facility website. Know what unit you're applying for. And kind of get your mind in the right area. And then have a great resume or CV. And we'll talk about resume here in a little bit. Hand that resume to them. Have multiple copies available. If you gotta do some type of teaching component or some type of other component, that kind of builds back into your being prepared as well. Have multiple backup files. Have a printed out copy. Have a copy on your USB drive. Have your computer with you if you need something like that. Shouldn't have to do that for any type of nursing role, but you never know. For my Southern Union job, I had like 7 different backups of the same presentation. And I had like 3 different clickers and all kind of stuff. I had a bunch, probably was over prepared. But you never want them to ask, hey, what happened, or having technology difficulties when your resume says I'm great with technology. Doesn't look good for you, okay? Or being prepared, you don't have any resumes, or your resumes are all crumpled up and stuff, and you just wrote I'm organized and clean and professional. Well, that doesn't look clean and professional if your papers are all crumpled up, right? Have a nice folder, a binder, that kind of stuff. I know this stuff sounds kind of self-explanatory, but getting you in that right mind. Question about job interviews? Nope, okay. Resume writing. What to include? So these are gonna be kind of the big key factors, and a lot of y'all may already have a resume. If you haven't, highly recommend you start working on a resume. If you have questions about a resume, shoot me an email. I can kind of critique your resume. We can kind of build upon your resume. I'm not great at resume writing either, so I get Dr. McCarty to critique mine a lot. But I've got a pretty good template by now to kind of add and build upon. But these are kind of your key elements. So some type of heading. Your heading is going to be how you get in contact with you. So basically your name, your email, your cell phone. A lot of times you can put your physical address on there as well. So if they need to mail you documents or mail you an acceptance letter, something like that, they can get in contact with you. Skills and experience. List all your skills that are most relevant to the job position. If I'm preparing for a nursing job, do they really care that I was the best dog walker in 2012? Probably not. So let's kind of keep it specific to the role, okay? But these can be things like, I've had X number of hours for your clinical rotations. I can put that in there. You can talk about your ER rotations, your ICU, your med-surg, OB, peds, all that kind of stuff. You can put that in there. That's your skills and experience. Your education. Of course, you're not gonna lie and say you already completed if you're starting to do interviews now, because some people are applying and kind of looking for jobs now. But you tell them estimated completion of May 2026, okay? They're okay with it. If you have any other previous degrees, go ahead and put that on there, that's good. Any certification or awards that you might have. So if you got the presidential scholarship to come here, put that on there. That shows that you're committed to your education, that you're kind of a well-rounded person. You can also kind of put some of your volunteer hours in here as well. You kind of sprinkle that into your skills, experiences, maybe your education background, that kind of stuff. You can put that in there. Other certification too, so you can put like your BLS certification. Drew, you probably have your BLS certification. Some others probably do. I don't know if you have PALS or not, but you can put that in there. ACLS, y'all aren't ACLS certified yet, but if you get ACLS certified by now, you could probably put some of your X-ray certifications on there if you want to. So that kind of stuff, you can put that on there. That's good, that's what we want. And then reference list. Some people put references directly on their resume, and then others will put as needed or upon request, something along those lines, with your resume. That clear and concise, that's coming back up again. Clear and concise language that shows active engagement. I don't need all the fluff, all these big long words that you use synonyms for all the time. I don't need a long chat GPT box written for all my stuff. I want a quick overview. A lot of times we'll keep it down to a page. So as soon as that interviewer looks at it, he can get a pretty good, well-rounded picture of who you are. If it's multiple pages or multiple fluff, he's not gonna do it. He's just gonna scan it and say, okay, and he's gonna move on. He's not gonna read through that whole thing. So you're trying to present yourself in one page. And that's kind of hard to do at times, but that's why you want to use that clear and concise language. And then you're going to market yourself for that particular role. Your resume may change depending on what facility or where you're applying to work at. And so if you have OB experience, you're going to talk about your OB experience for that particular role. And you're going to use some of those kind of highlight words, keywords, phrases that really shows your experience in that OB field or your ICU field. You stay calm under pressure. You manage stress well. You're able to delegate, able to make quick decisions. Some of those kind of key factors, key words that they look at to kind of see if you're kind of a good fit for this type of role, okay? Here we're trying to market ourselves. Make sure that I'm the most presentable person that I can be. Like I said, you may need to change based on your position role. So let's look at a resume. This is my resume. This is by no means perfect, so but it kind of gives you a general idea of what a resume should look like. So I have my heading, pretty simple, easy to read. Natalie, you can't use pink font for all of this. It's got to be probably Times New Roman, black font.
You know,
Easy
I
to
looked
read.
at resumes last night, I brought up a pink resume.
Yep, can't do that. I wouldn't recommend doing that. If you hand a pink resume to me, I'm not gonna read it because I don't like reading in pink, okay? I want a nice, easy read on my eyes. Education background. You know, I have my Auburn University stuff, my Jacksonville stuff, my Southern Union experience. I kind of put my awards in there. I was summa cum laude at BSN. I also highlighted that I have a dual track master's. So I have my F&P and my nurse educator. So that shows that I have 2 master's degrees. So that's kind of the experience that they're looking for. Always kind of have your completion dates out here by at the end. So it kind of highlights how you went through your academic process. And then I have my work experience on here. So currently I'm an academic professor. It's okay to do August 2024. That's when I started to present. So now they know currently I'm still in that role. Big thing with your work experience is going to be not really having a huge gap in your timing, okay? They're going to know why you have such a huge gap. They're going to ask you, why didn't you work from here to here? What's going on here? Why did you take time off? Because that's going to affect them as well. Are you going to take a ton of time off when I hire you into this position? So they want you to see that you're consistent. You show up to work. You stay for long periods of time, that kind of stuff, okay? With your work experience, and I haven't updated mine yet, so this is kind of a bad look at it, but you can talk about kind of your skills, your oversight, what you did in this type of role. And so I haven't updated that for the academic professor, but for adjunct clinical professor, oversight of ADN students in the intensive care unit. Like I said, August 24, so there's no gap in my work experience history for that. And then also, I was a registered nurse in the intensive care unit, has all of my history, all the time I had a travel nurse, that kind of stuff, kind of shows my experience there. Really no gaps in where I worked, okay? And then I have my multi-care technician experience on there as well. If I was looking for space and trying to cut down my resume to make it really fit on one page, I could probably take this off now, okay? I started in December of 2013 at East Alabama. That was such a long time ago that I probably really don't need that information on there. My MCT experience is really not gonna help me in my new job role. So that could be one thing that I could cut off from there. Then you kind of have your skills section, your skills area. So I have experience with Cerner, Epic. I have up-to-date different medical guides and stuff. So that makes me marketable to this position. They don't have to train me for Cerner. They don't have to train me as much for Epic. They know that I'm competent enough to have those type of skills. Great communication, time management skills. Those are important skills to have as a nurse, just all around, okay? I put the use of Microsoft programs like Word, PowerPoint, and Excel when I applied for Southern Union. Same thing with Canvas application for the student and instructor view. That kind of marketed me more towards a nurse educator type of role, okay? Then I also put my critical care nursing experience. So if I ever wanted to be NP somewhere, they could see the kind of skills and stuff that I have. This has kind of been building upon year after year as I've gained experience, added new things, took things away, that kind of stuff. With that, I also have kind of a skill set for my educational experience. So this is all the clinical hours that I had to complete for my nurse practitioner. I had to do 750 hours, so it's really marketable for me because they know I have a well-rounded experience for my clinical rotations. Also have my nurse educator clinical hours as well. And then I did some award and scholarships. So I got a transfer scholarship, and then I was at the Honor Society for Auburn University as well, okay? And then at the end, they know all my certifications. So my nurse practitioner certification, they know I'm already certified, so I don't have to go through all of that paperwork and that process before they hire me. So they know I'm ready to start day one. Of course, I have my nursing license, so they don't have to look that up. BLS, ACLS, PALS, I know I'm up to date on most everything. I don't have any references on here, and then I could just say, hey, I can give you references if you need them upon request, something like that. Okay. Questions about a resume? If you want to see a really good resume, let's look at the next one. This is Dr. McCarty's resume. So very similar format. It looks really familiar to mine because she built mine. But again, has her contact information. I'm ready and available. I can call her, I can email her, her type of role. She's got her DNP project on there. She's on the scholarship community. She's been a speaker at several places. She's been on some research symposiums, that kind of stuff. Big thing is she's smart, so it looks good for her, okay? That's how she makes herself marketable. Again, has all her licensures, certifications. She's part of the Honor Society, National League of Nursing. She's also with the nurse practitioner as well. And then she actually has her references built in already as well. So this might be more than a page. But you can kind of tailor it to your specific role, your specific purpose, however you need to, okay? Does everybody have a resume written or kind of a thought about a resume for the most part? Okay. Like I said, I would kind of fine tune it, update it. If you haven't looked at it in a while, go ahead and kind of look at it, make sure all that information is still correct, that you have your work experience in there like you need to. Add your clinical hours, your clinical experiences throughout Southern Union, or if you have anything else. And kind of get that updated and ready to go because you're gonna need them for your job interviews. A lot of y'all are gonna start interviewing here pretty soon. We start to encourage y'all to start looking at jobs, even if you're not gonna apply for them, to go out there and kind of get a general idea of who's hiring, what units, kind of the base pay, that kind of stuff. And you can go ahead and start applying for job positions, and some of these employers will start taking a look at you and kind of be a contingency plan contingent on you graduating and passing your NCLEX. So you can go ahead and have a job ready and lined up before you even graduate nursing school, okay?
Do you know how many clinical hours we're supposed to have up to this point?
Yes, so,
You can pull a report on the trajectories.
you can pull a report on Trajexis as well. And then if you look under your professionalism tab, all the way down here at the bottom, here is your credit hour and your contact hour breakdown. So your clinical hours that you completed during your entire, Southern Union experience here. So this would be something good that you could print off, as well, and have this readily available, as well. And so it kind of breaks it down for you. Here's your, hour breakdown. I'll put a lot of work in 5 semesters, okay? So use that information, all right? Market yourself. You didn't go through all this pain and annoyance to not use it, right? So use it. Okay. Questions about that? Okay. Next week, remember, no class. It's Martin Luther King Day, so take a break. Don't take too much of a break, bless you, because your benchmark SC is at the end of the week. Make sure you get your prep work printed off, completed. It is handwritten. And then the next week is gonna be a fun class experience, I think. I'm excited about it. It's job interview week, okay? And so, what we're gonna do is, we're gonna conduct job interviews. Get you in that mindset and thinking about that. So, I would highly recommend that you prepare those types of questions, those type of answers that you would. Bring an updated resume, dress to impress, okay? Don't wear your PJs the week after next. Dress like you would dress for a professional job interview. We'll have Dr. Shiger, we'll probably have maybe Dean Davis in here as well. And we'll do some job interviews. Pretty excited about it, it's gonna be good. It's gonna be fun. It's gonna be low stress, not necessarily for a grade, but I want you to take it seriously. I want you to be professional about it, and really gain something out of that experience, okay? But I'll send out another announcement, probably next week to kind of remind you about the job interview day. But that's what we're gonna do 2 weeks from now, okay? Everybody sign the roll? Everybody sign their Children's of Alabama confidentiality agreement. Thank you. Once I have all that, you are free to go.